Some of the most advanced research on ACL injuries takes place every day in a lab in Fargo, North Dakota. The ACL, or anterior cruciate ligament, is a thick strand of tissue which helps to connect the leg bones and stabilize the knee. Dr. Benjamin Noonan and Colin Bond collect and study data from athletes and ACL patients across the Dakotas and Minnesota to try to better understand the causes of these injuries, as well as their treatment and recovery. The project is called the Sanford ACL Initiative.
The overarching mission is to improve the quality of life of our patients as it relates to ACL injuries. It's an area where we can do better from a surgical standpoint, from a patient care standpoint, sports psychology, return to play testing, research, surgical techniques. There's really room for improvement on all of that.
Dr. Noonan set out to collect as much ACL data as possible, which is where Bond comes in. He runs the lab, which is filled with specialized cameras and sensors to collect 3D motion capture video of their subjects. In the lab, athletes run, jump, and cut, while Bond measures their movements.
Really, the goal of the lab is to quantify human motion, and we apply that typically to athletes. There's a few risky positions related to ACL injury. So we call it valgus or knee abduction, but the knees falling in towards the middle, towards each other. Sometimes it's called kissing knees, for example. We know landing with really straight legs is another risk factor. We know that having pelvic drop, so landing and having the side of your pelvis opposite the leg you're landing on really drop towards the floor is a risk factor. So we know a lot of these ways that you move might elevate your risk for an ACL injury, but it's really hard to quantify them all simultaneously until we've had this 3D motion capture equipment.
For uninjured athletes, the collected data can provide a baseline, while also giving individual athletes a visualization of their form. For those who are recovering from an injury, it can help measure their progress, while also providing information that could prevent possible re-injury.
Unfortunately, 20, maybe even 30% of young high-risk athletes are going to re-injure their ACL. So using this equipment, we can really measure with high fidelity who might be at more of a risk to re-injure themselves compared to others.
That's been one of the key findings so far in the research.
One thing we've learned is we kind of swung too far in getting people back too soon, and we recognized that was contributing to re-ruptures. So that's one of the biggest bummers right now is when I'm sitting with this young athlete, I'm telling them, look, we need to do a surgery to give you the best chance of having a long-term good outcome of this knee, but part of the surgical intervention is you need to wait at least 9 months. And that's devastating for these young athletes.
The ACL Initiative isn't able to detect who is most at risk for injury just yet. There are too many factors to take into account, including the type of sport a given athlete plays. By collecting this data, though, the team hopes to determine proper recovery timelines for injured athletes while also building a data set that can teach them more about ACL injuries well into the future.
Everything that we learn along the way can be applied to really any level of a patient or an athlete. It's just that these young middle school, high school, cutting, pivoting, twisting athletes, those are the ones that have a substantial re-injury rate. Fortunately, when you get into your 30s and 40s, if you have a good surgery and do a good recovery, your risk of re-rupture is quite low. But we can still learn a lot to make your outcomes better.
In Fargo, Jason Anschutz, Sanford Health News.